Hi, I'm Celia Boothman, founder of LTR Coaching, and I'd like to welcome you to the Inspired Triathletes podcast, where I'll be bringing you stories from female triathletes and taking on topics that are important to women in the sport. Okay, hello and welcome to today's episode. Today I'm going to be talking to Jess Preshaw, a consultant gynaecologist in, I don't know where you work actually, where is it?
I work at Southmead Hospital, so that is
Right.
North Bristol.
Okay. Oh, it's not too far away then. I
There
was
you
just in
go.
Bristol. There you go.
There
So yeah, we've got Jess on to talk about all things women related to do with cycling, because Jess is a keen cyclist herself. And we're going to start off just to talk about how you got into cycling, the kind of riding that you do personally, what you love about it, and we'll just take it from there. So
Well, firstly, thank you, Celia, for inviting me on to do this. It's a really lovely opportunity. So it was probably about 10 years ago when I moved to South Africa for a year. And it was to do to work over there and do obstetrics and gynecology as part of my training. But I arrived and was invited on this mountain bike ride on a game reserve. So I found myself on this really uncomfortable bike doing about 70 kilometers each day of mountain biking through the most fabulous scenery with zebra and giraffe. There was even a rhino. And I absolutely loved it. I was last by a really long way because I hadn't done any training and didn't really cycle, and bought a mountain bike there and did quite a lot of mountain biking and would do these mountain bike events. And then when I came back here, morphed into road cycling. So now I do have a mountain bike, which I transported back from South Africa, which sits in the garage. And now I just road cycle. And I commute. I just love, I mean, that's the beauty of living in Bristol.
Yeah.
I live in the city centre, but I just, 5 minutes and you're out into beautiful countryside, and I just love the freedom that it gives you.
Yeah.
And
yeah, it's a nice area for cycling actually, that, because you haven't got that, like, I've got to cycle for half an hour to get out into something that's a bit more rural or less busy with traffic and that kind of thing. So
it's just fabulous. And I mean, you can finish work and suddenly find yourself, out near Clevedon and by the sea, and then you're just sort of cycling back into Bristol at the end. Oh, it's just, I love it. And the other bit was that I just do this for my own sort of enjoyment, but I joined a charity bike ride this year to raise money for Endometriosis UK. And so a group of us, it was primarily a group of gynaecologists, cycled from Manchester to Belfast, and we covered 250 miles in 3 days with a ferry crossing from Conway in Isle of Anglesey over to Dublin. And I'd never cycled that distance in my entire life before. So that was quite a shock to my own system. But yeah, that was a really incredible experience. And we all sort of bonded and we raised a lot of money for charities. So that was really great.
Nice.
And now I'm
organising.
organising.
Did you train a bit more for that one then?
I did train a bit more for that. It wasn't just my normal commute. I was like, no, I actually have to do a bit of distance so that I'm not going to lie down. But it was fine because we broke it up into sort of 20-mile aliquots, and at each stop there'd be snacks.
Snacks. You need snacks when you're riding that kind of distance.
Exactly.
Definitely.
And there was so much energy with the ride and group cycling. And it was just the most positive experience. So yeah, next year we're going to do another ride, but I think we're doing Stranraer down to Leeds. So another 250 miles, but that's going to be like across a bit of Scotland. I really hope that's nice.
Yeah, it could be really amazing, and it could be kind of
wet,
dismal as well.
And grey.
I think I was listening to like Radio 1 a little while ago, and there was someone doing some charity bike ride, and it was all the way down through the country, and I think it was just raining and raining and raining, and I don't think they did much, training to be able to do, they're just kind of like DJs on the radio doing it, and you think, my God, it's quite a big thing, because if you train for something, it makes it a lot easier to deal with. But people that don't necessarily have trained properly, or they've done a bit and not, it's just, it blows my mind when I hear people doing that, because it's like riding a bike for that amount of time. You don't realize how uncomfortable and painful it can actually be until you're there.
Oh, absolutely. And then I arrived at this conference because we were cycling to a conference. The following day, I was like having to walk around being very professional in my sort
Yeah,
of work outfit with my heels. I was like, God, this is a bit tiring and a bit of a struggle.
yeah.
Fine. But yeah, but
Yeah, no, it's a long, long way, and different things that you would normally do. So yeah, and so you're with a group of gynecologists. What is it that kind of I know you've been on the GCN show. They've
yeah.
done a little segment with you, which is great, and that's how I heard about you. So I wanted to get you on to have a chat with you as well. But what was it really that inspired you to start talking about this? Because you do on X, it's called now, isn't it? Not Twitter. But I know
Yeah.
you talk about women's cycling and all, issues to do with women's health on
Yeah, I
there.
do. I mean, the GCN video came out of the fact that a male colleague of mine, who is a urologist, did a very popular video for them on men's issues and cycling.
Right.
And that was about 3 years ago. And I think they've just been sort of seeking for somebody to cover women's issues because there's just
Mm,
no, well, or very, very little information out there about it. And
mm,
so they were wanting that to be covered. And yeah, I then got approached to do it, and it was something that I was already really interested in because, this is stuff that I talk to patients about
yeah.
all the time. Um, and whether that be pelvic floor issues, vulval issues. I mean, my interest is particularly endometriosis. But yeah, having an
Yeah.
opportunity to just create some really sort of vibrant educational content
Mm,
was just a really lovely opportunity, really. I
yeah. And
couldn't
so,
turn it down.
yeah, no, it's good. It does need talking about, and we do need to be, have those conversations, because it sort of goes on behind closed doors, doesn't it? It's kind of like you're in. I remember going to a time trial one time, like a 100-mile time trial, and it was the first time I'd been in with a fairly large group of women, because it was a championship of some sort, and it was my first time going there. But they obviously, like, regular cyclists, they do a lot of distance cycling, and we were in the toilets kind of like trying to get changed, because that's the only place we had to get changed, and
Found
they're
my
sort of
on here.
slapping pseudocreme on themselves, going, yeah, this is great, and kind of talking about all the things that they did to sort of deal with saddle sore and all that kind of
Yeah.
thing. And it was like sort of wide open. It opened my eyes to the fact that, oh, it's not just me that's like
Yes.
dealing with this stuff. This is common kind of issues that we have to deal with, and they obviously had their solutions. Not sure if they were the best, but
But you're
I
right
did kind of.
about it. People are really embarrassed about it.
Mm,
People are really embarrassed about it when they come to see me, and I recognize that people don't wake up in the morning and go, "Oh, I really want to go and see a gynecologist today." But at the same time, this is something that I think about and talk about all the time. So
mm,
shouldn't be embarrassed about it. And the fact is if they're experiencing a problem, somebody else, probably in their very near vicinity, is probably experiencing a very similar problem. And maybe by talking
yeah,
about it, a solution can be found.
yeah, definitely. And it's like, we sort of, you hear it like through the grapevine or whatever. It's like not always, the best way of hearing about something that isn't, it's just a solution that someone's found. It might not work for you either. Like everyone was kind of going, oh, I do this, I do that. It was quite interesting, actually. I can't remember all the ins and outs of it, but I thought, oh, I quite enjoyed the kind of like down to earthness of it there. No one was really worried at that at that place about talking about that. So it was cool. But yeah, it comes up so much when you're talking to female cyclists. And like, oh, my saddle, I'm so uncomfortable. And yeah, it can be a real problem for people. So you said people come to you all the time. Do you tend to get a lot of women that have cycling related issues? Or is it
think it's more that I see a lot of women who have vulval issues. And so that's
right?
what they're referred to see me with. And then you start sort of delving into that, or it might be sort of pelvic floor issues. And you
Mm,
delve into that, and something that you ask about is, well, what's the impact? What does this mean for you? And I suppose I'm
mm.
quite chatty and I'm quite
Yeah.
open about sort of exploring some of these things. Um, but I suppose I'm always interested about, what's motivated somebody to, go and see somebody. Is it pain? Is it
Mm,
and I do a lot of stuff with pain, a lot of stuff with pelvic pain. So a lot of that is about, what's the impact? What is the goal? What is the goal of treatment? What do you want to achieve from this? And out
right.
of that will often come, people saying, oh, actually, I find this is a real issue when I'm cycling. And so I'll
Right.
be like, right, okay, well, actually, there's this little video you could watch, and let's just target a few things that I think might be really useful for you.
Mm,
So it's either they've developed some sort of problem or discomfort because maybe they've been cycling a lot, or they've come to me with another vulval skin condition. Maybe
mm,
they've got something called lichen planus or lichen sclerosis. It's sort of an autoimmune condition in the skin, and it causes really
okay.
sore, itchy skin. But you can imagine that if you've already got a skin problem and then you want to cycle, it's going to make it 100 times
Yeah.
worse. It's also managing it from that aspect. And
Mm.
I um, sometimes also it's just clues. Like people come into clinic and they've got a cycle helmet and a big bike bag, and then you're sat there and you're looking at
Okay.
something and you're talking about this soreness, and I'm like, how does it affect you when you get on your bike this morning? And then they actually sort of the eyes widen and they're like, oh my god, it's awful, or
Mm,
I've had to do this, or what would you recommend? And so that sort of segues neatly into a conversation about some different things that you can do, and to make a
mm.
difference, really.
I
And
think that's
yeah,
such a great question to ask. I love that you ask that to people because a lot of times when you go and see a GP or a doc, they don't necessarily think about your life in like what you want from your life. They just see you as another patient that is like, okay, you're going to be like everyone else, and I'm just going to treat you the same as everyone else. So that is such an amazing question to ask, and I really appreciate that you do that. And I'm sure everyone that comes to see you does as well. Actually saying what is it that you want and what do you want to get from this? Because I mean that's a fundamental question we should always ask, isn't it? Whatever we're looking at.
it's what's that person's agenda? That's what
Mm,
I need. And sometimes, yes, I might have a bit of agenda as well. Ultimately, I want that patient to
mm,
have the most positive experience. But maybe it's I have to rule out something sinister, and but that's
mm,
when our agendas normally align. But
yeah,
yeah, I mean, why did they bother to come to see me? Like
yeah.
they had a reason. There was
It's
something.
causing a problem
Yeah,
somewhere, and you need to find out what it is
yeah,
that's causing that. Oh,
that's what I
that's cool. Okay. Um, so
yeah.
yeah, you specialize in endometriosis.
Yes,
I
that's the
quite
word.
often
Very long word. Yeah.
I know.
Ah,
People sometimes ask me about it, and I really don't know that much about it. So yeah, if you can kind of
oh,
give us a bit of information about endometriosis and what kind of impact it could have on you if you are training for endurance events
um,
or cycling.
I could talk for a long time on this topic.
Okay.
Brief. Yes, so this is sort of what I specialize in, that and its sort of sister condition, adenomyosis and pelvic pain. And I co-lead our endometriosis service at Southmead. So we're an endometriosis centre. But endometriosis is where you have endometrial-like tissue, so tissue that normally lines the womb, and it's outside of the uterus. and it is most commonly found in the pelvis. So it might be on the fallopian tube, on an ovary. It could affect the bladder. It could affect the bowel. And depending upon where it is, depends on the effect it might have on you. And some women have it in sites that are distant from the pelvis. So, for example, you could have a lump of endometriosis in your cesarean scar, or you could have it in your navel, or some people I see have it in their chest. So
Right.
it can affect lots lots of bits of your body.
Yeah.
I mentioned adenomyosis. This is where you get endometrial-like tissue. It's also misplaced endometrial-like tissue, but it's in the muscle wall of the uterus. But I mean, endometriosis is common. So
Mm.
it affects well, it is present in about 1 in 10 women.
Wow.
So, I mean, hugely common. That's like diabetes, but yet we
So
don't.
could you have it without realizing it? Like if yeah.
Absolutely. And about 50% of people who have it don't have symptoms from it. But that is
Yeah, it doesn't
still a
cause any problems.
massive cohort of women who
Mm,
have it and are affected by it. And it's a
mm,
whole body systemic chronic condition.
okay.
You can't, there's no cure for it. And it causes different symptoms in different people. So it primarily causes problems with pain. So that might be painful periods, pain with sex. Some people have chronic pain, daily pain. Might
Mm,
be pain with your bowels, your bladder. You might have an overactive bladder. You might get lots of bloating. And then people are often really fatigued with it. That's a really big symptom with it. You're living in chronic pain, chronic inflammation,
mm,
and it can interfere with your sleep. So, and then some people have really heavy periods, bleeding that means that they're flooding, they can't leave the house.
yeah.
So, and I suppose if we move that into how it might affect, you know, triathlon or
The
your
training,
training,
yeah.
um, I think it's like what would triathlon affect on endometriosis? Well, I was thinking about that, and I suppose one, if you're experiencing pain, and then you have a stressful event, pain
Mm,
experienced is it's often more severe. So,
mm,
it might make pain flares more frequent or more intense. And so, if your body's in stress, that can happen, and that might happen with, excessive training. And
yeah.
also, I was thinking that if you're training a lot and you are calorie deplete, then some people find that their whole menstrual cycle is just switched off. And I
Right, yeah.
suppose that might be a bit of a benefit, if all your pain is coming with your
Mm,
period and suddenly you don't have a cycle because you're training so hard and you're not really supporting it with enough calories. But I would say that's really not a good long-term solution,
no.
because absolutely, like, quashing your menstrual cycle is not a healthy way to be, because your hormones.
No, well, that's like the old sort of, oh, well, if you don't have your period, we'll put you on the pill to start your, to get your periods, which isn't starting your period. It's just masking the symptom of you not having a period. It's kind of similar to that, isn't it? It's like, oh, it's,
Oh,
I guess, I don't
no, I
know.
don't think you're right in that, because then I was also thinking, well, how would endometriosis affect your training? And, I think if you are struggling with a chronic condition, chronic pain, poor sleep, fatigue, I mean, it's
Mm,
obviously going to affect the way that you train, the way you perform, your, if you're housebound with your periods, how are you going to keep up the training? What happens if that
yeah.
falls on events that you've just, you've been training really hard to complete? I mean, that's
Mm,
devastating. And the other bit is that some of the treatments that you might need for your endometriosis can also have their effect. So,
yeah.
people having to take loads of painkillers, that can make you feel really sluggish, make your bowels really sluggish, make you feel fatigued. It can, some people with endometriosis find themselves having multiple surgeries. Well,
Right.
it's not ideal. If you've got multiple
Mm,
bits of time out to need to have an operation and recover from an operation, that's also going to be really impactful. Uh,
mm.
and then, yeah, you mentioned hormonal treatment. So
Yeah,
we
so
often,
that
yeah.
can help with endometriosis, can't it? I'm aware of that, but yeah, so talk us through.
Oh, well,
Yeah.
it's just that, endometriosis is a hormone-dependent condition. So we
Mm.
often use hormones to help suppress it because it can be a really effective treatment for endometriosis. I mean, it's not for everyone because some people might be trying for a pregnancy. And so
Yeah.
taking hormonal
Mhm.
therapy is going to be contraceptive. So you couldn't take it in that
Yeah.
situation. But there are loads of different types. It doesn't matter necessarily which one. It's about trial and error to find one that works for you. So whether that be an
Mm.
oral contraceptive pill or the Implanon or the depot injection or a hormone-based coil, if you're wanting to avoid systemic hormones, or there are injections and tablets that place you into sort of a temporary medical menopause. So that's like next
Mm.
level medical treatment for endometriosis. But
Yeah.
they, there we do normally advise trialing some sort of hormonal treatment to try and suppress it.
Mm.
We do end up having conversations about that. Yeah.
Yeah, because I mean, the thing that sort of jumps out for me as well, it sounds like a really difficult situation to manage. But like, when you're in a big training cycle, there's a lot of inflammation in your body anyway, and having that on top of it must be very hard to manage. I guess, good nutrition, getting enough sleep, what other ways are there to manage that inflammation? And do you have any success stories? Because it sounds kind of grim at the moment. It's like, oh my God, this
Oh,
sounds really
the answer
hard.
is yes.
Mm.
So you're completely right. Self-care is really important. So yes, adequate sleep. There is randomized control trial evidence for yoga with managing
Right.
endometriosis associated pelvic pain. So there's loads of different components, whether that be mindfulness. Some people find benefits in CBD oil, but
Mm.
what I would say is that I really preach about having this, preach is maybe a wrong word, or encourage someone to really take a sort of a multimodal, we call it a multimodal approach, basically just really looking at the whole person and tackling it
Yeah.
from every angle. And yes, and by doing that, we get success. It's not just relying on hormonal treatment alone or not just relying
Mm.
on operation. It's about really taking a much broader approach to it. Um, and yes, with that, we can manage it and manage it well. And I've got a fabulous endometriosis nurse in my team. And so she also
Mm.
offers support for people because it's really, unpicking what's going to work for people, what's going to suit them.
Mm.
It's really personalized.
Yeah.
So, yeah, it's not all doom and gloom,
Okay.
I promise.
That's all
Um,
right.
Actually, you mentioned about nutrition. Like, nutrition
Yeah.
is important. And for hormonal health, it's also really important. I
Mm.
really, I'm very keen on the microbiome and then about
Yeah.
diet that supports the microbiome. So prebiotics. So I basically I'm always encouraging people to have a lot of prebiotics in their diets. So lots of fiber. I
Mm.
ferment lots of things. So I make my own
Yeah.
kimchi, kefir,
Lovely.
kraut, kombucha. So, having, introducing healthy bacteria. I talk to people about um, lots of different plant-based foods in their diet,
Yeah.
colorful foods to have all those polyphenols, um, avoiding ultra-processed food,
Mm.
trying to avoid a bit of alcohol,
Yeah.
keeping well hydrated, um, all of those types of things. So they're really
Yeah.
important in endometriosis and inflammation in life, really.
Yeah, because I was going to say, I mean, that is leads us back to information, because all that nutritional component is so important with that, and the processed foods that, if you eat a lot of processed foods, then it definitely increases your inflammation. So we do need to work on that. It's probably one of the things, you know, if you've not been eating well your whole life, it's one of the hardest things to change because you're in a habit of it and you need to get out of that habit. So it's not an easy fix, as it were, but it's so important, and not just for that, condition, but everybody, I think, needs to be
It's
looking at that.
definitely. And
Yeah.
it's also where if people are struggling, there are loads of great resources out there,
Mm.
or seek some help, you know.
Yeah.
maybe touch base with a nutritionist to see if they can give you some tips, or just make some small changes. It's like build on a tiny.
Yeah, it's just yeah, you that's what I say to people, just a little do a little thing, like swap one thing, because people want to change everything at once because it's like, no, just it because it won't stick then. It doesn't stick if you try and change everything at the same time. You need to have like gradual things that are achievable and that you're not going to fail on so that you can celebrate and then go, yeah, I did that, and then move on and you've got time to integrate it then as a habit, haven't you, if you do it gradually. So yeah, I think people need quite a lot of support with that, but it can be done definitely.
Yeah, it can be. Exactly.
So yeah, just go back to my question. We've talked about endometriosis and um, yeah, and we've talked about oral contraceptives. And so some one of the things that is kind of important, or one of the things that I talk about quite a bit, is having a natural cycle. And this can follow on from endometriosis, because obviously you're not going to have a natural cycle with endometriosis if you're on an oral contraception. But if you are healthy and you've got a natural cycle, it can be a really good performance enhancer. So we were talking earlier about how, when you get into a state of nutritional deficiency, you can go into that red syndrome where you don't have a period. Having a natural normal period, because they're not normal. um, do you see that as a really good health indicator for people? And
Oh, yeah, 100%, Celia. So your menstrual cycle is just a really lovely barometer of well-being. If you do have a really regular, but that is then difficult for people who are, and I have that conversation with people because they're like, no, I want to know what my body's natural sort of position is. And I'm like, I get that, but at the same time, you do have a medical condition that does respond well to a hormonal treatment. And
mm,
stop that condition progressing, coming back, I would recommend some hormonal treatment, and that's
mm,
okay. And I
yeah,
and I that is a difficult conversation to unpick because that's a difficult thing to unpick, to balance in your head. I have a lot of people who
yeah,
I don't want to be on a hormonal treatment, and I'm like, I hear that and I get that, but you've just told me that the worst time is when you have your period. What if you didn't have your period? And they're like,
mm.
oh, but maybe I want it, but I don't really want to be housebound and in that much pain. And I'm like,
Yeah,
maybe we have to balance it. And, you would take an aspirin if you had a heart condition. So
mm,
maybe we need to reframe this and be like, well, this is the tablet that we currently have available for this condition because
mm.
there isn't a non-hormonal treatment yet. And hopefully,
Yeah, I know it'd be nice if there were, because I can understand how I'd probably be exactly the same. I don't like to take medication really. It's like I just kind of want to manage things myself and kind of with the tools that I've got. But obviously sometimes you do need it, and if you've got a condition like that, then it is something that is going to help you and make your quality of life better. But yeah, getting your head around that must be quite challenging for some people.
I often
Yeah.
will then, potentially talk to people about a coil, like as in a hormone-based coil, because then at least it's more locally acting hormone.
Yeah.
So that can be
So that can be a solution for
that
people.
can be a solution.
Yeah.
And yes, some people are very hormone sensitive and still respond to the small amount of systemic hormone that you get from that, but the dose is really quite low. So that can
Mm.
often work well for people if they've been on some form of hormonal treatment that's, maybe it's messed with their mental health, or if they've just not like the sort of overall sluggish bloating feeling. If that's not,
Mm.
some people take stuff and are absolutely fine. It's really
Mm.
individual. But that can sometimes, having some sort of locally placed hormone can potentially be a solution for some
Okay.
people. Yeah.
Yeah, that's good to know, because I know it's kind of like the alternative. If you're looking at hormonal contraception, it's one of the ones that Dr. Stacey Sims recommends, because she says it's more like a natural cycle
Mm.
in that you still, as you say, it's low level, so you still kind of go through a bit of a cycle, but it's not the same as being on an oral contraception.
Yeah, exactly.
Okay. So we'll move on to a little bit more sort of cycling specific stuff.
Yep.
If you're cycling regularly, do you have like more of a risk of having a urinary tract infection or getting issues in your genital area,
You
or
do.
what kind of
Well,
what's going on down there?
yeah, absolutely. No, yes is the answer. You are at increased risk of infection. So,
Okay.
from a bladder perspective, you might be dehydrated if you've gone out for a long ride, or I mean, if you've done any form of intense exercise. So, it's really important to stay really well hydrated, drink through your ride, drink afterwards, but also all that friction, moisture, heat. Um, Pressure in that area, it can change well, one, it creates a warm, happy environment for
Mm,
bacteria to flourish, and that can increase your risk of infection. So, whether that's a urinary tract infection or some sort of vaginal infection, that might be a yeast infection, so thrush, or something like bacterial vaginosis. So, that's where you get like a change in the balance in the bacteria in the vagina, and
mm,
you get an overgrowth of certain types of bacteria, and that can lead to quite a lot of discharge. It can be really quite unpleasant and quite smelly and just really off-putting for people. And that can be really, yeah, really upsetting to deal with.
yeah.
Um, and also, you can, all of that, just, you have a natural sort of bacterial environment in that area. And all that pressure, heat, moisture, sweat, time in the saddle can just change that natural environment and then lead you into risk of infection. So, it's important to have, well-fitting shorts, and to not linger in your clothes after a ride, and to wash your cycling gear on a high heat. And then everyone goes, oh, but I don't want to wash my
Yeah.
really expensive padded cycling shorts. And I'm like, I know it's that balance, but maybe just like occasionally you should do, or if you've had a problem more
Yeah.
immediately, maybe you are going to have to accept that you're going to have to put it on a higher heat for just that, that cycle to try and nuke
How,
anything that might be in it.
sorry to interrupt, but can
No,
you,
too.
so I used to get quite a lot of yeast infections when I was trained, and I think it was when I was training hard, like towards the end of my training blocks, every night it would happen. And it also happened when I was pregnant as well. It was like a recurring thing. So I think it's related to sort of stress and fatigue with me. But I read somewhere like if you don't want to like put the shorts in the wash, you can pour boiling water over the chamois. But I don't know whether that would make a difference or not. What's your thoughts on
Um,
that? Because I have done that. I did do that for a bit because I was like, oh,
did you find it
God.
helped? Did you find it
Well, I
helped?
don't know because I was doing other stuff as well. So you never know, do you, whether it was
I mean,
that or not. But would that
ultimately,
be enough to kill stuff in the
should
chamois or
do. It should
yeah,
do. I suppose you might need to soak it for a bit rather than, because if it's
just
in
pour it on?
much.
Yeah.
I mean, it should do. If you're putting boiling water on something, that should sterilize it. Um,
Mm.
so I don't think that's an unreasonable thing
Give
to
it a try.
do. That exactly. And I mean, some people, they might want to wear underwear. Well, I mean, I would say avoid underwear to avoid some chafing in
Yeah.
that area. But if you are going to wear underwear, I mean, just got to wear some really boring, sensible knickers, sensible cotton
Mm.
underwear to try and sort of, and then wash those ones on a
Well, you
high.
won't want to be in some fancy underwear with cycling shorts on
No,
top.
it's not
That's
really
not good.
painful. Really
I,
good
just
to
in
do.
case I want to look nice.
Exactly.
It's
Um,
not very glamorous, is it? Cycling. Yeah.
but
Yeah, I think, I mean, the recommendation usually is like, no, do not wear underwear with cycling shorts because of the chafing. It's just like you're
also,
adding another, like that other, you talk about the friction, you're adding another layer, aren't you, there to rub against stuff. Um, yeah, so
to try and avoid the friction, it's about, I don't know, having a slightly wider saddle, getting a good bike fit. Uh,
yeah,
your pubic hair is really important. I've got to bring
yes,
pubic hair into this. But actually,
yeah,
there for a reason. It's like a cushion, it's a wick, so it will take moisture away from the skin. And then if people are shaving or waxing, they're often going to get like tiny little nicks in the skin, which are
Mm,
just like these beautiful little entry points or doors for infection. So you might then get boils. And so,
mm.
thinking about pubic hair maintenance, you've just got to trim,
It's
sadly.
really difficult though, isn't it? Because like, so for me, I swim, you know, when I was doing a lot of training, swimming regularly, and you're like, oh God,
That's a
what am I
really good point.
doing? It's
It's a
like,
really good point. And then balancing that, I suppose you could, if
yeah,
you're really desperate and you really were like, no, I've just got to potentially doing some form of like laser so that you're then not, and then leaving a bit of
mm.
time. So you're not constantly traumatizing the skin through like waxing or shaving. I suppose that would be the only other
I
way.
just do the sides and then just keep my legs together.
Yes, I think that's very wise.
Because
Exactly.
I did used to shave like in between my legs, just up to, you know, the edge, so just, you know, to keep things neat. But it did cause, when I was on the bike, it was causing issues. In fact, I was waxing at one point, like, and that, yeah, it wasn't good because I think I damaged. I probably did damage, and there was one area that it just got really swollen up, and it's painful every time I went out on the bike, and I just kind of had to suffer with this painful lump for ages.
Oh,
And then
that's
I read
awful.
that you shouldn't shave, so I stopped.
It sounds dreadful,
But
but I mean, I didn't do any related maintenance in that area up until that big 250-mile ride because I
right,
was like, I
you
cannot
don't need to.
imagine being really sore and
Yeah, it's not
getting
nice.
back on the bike the following day. I was just like, it's just not worth it. So,
No, it's not. It really isn't. And yeah, I think you can sort of. No one's looking really.
no, exactly.
There's a funny sketch. Oh, I don't. You might be. I don't know if you would have seen this, but do you? There was some female comedians that were called Drop the Dead Donkey or something like that.
Oh,
I just wanted to quickly interrupt here and say that it wasn't Drop the Dead Donkey. My mind is going a bit AWOL at the moment because it's the second time I've misquoted a reference. But the program that I was talking about is called Smack the Pony, and I'll put the link in the description below. Anyway, back to the show.
no, I've not
I'm
seen.
too young. But anyway,
I
they've
don't think
got
I'm
a
too young,
sketch.
but yeah.
If anyone wants to learn, it's a sketch, and there's a woman going in for a swim, and she's like, "Oh, I was going to shave, but I can't be bothered." And her friend's like, "Oh, it's all right." And she turns around and she's just got loads of hair, and she's like,
Oh,
"It's a really funny sketch." And if you look it up on YouTube, I think
I
it's
will look
still you
it
can
up
still
on
find it.
YouTube after this.
I think it's called Drop the Dead Donkey, and yeah, they did. It was. I really used to enjoy that. It was quite funny. They were female comedians, and they used to do quite good sketches. But there's one about pubic hair, and it's quite good.
Oh.
Okay, so yeah, we talked a little bit about the yeast infections and UTIs and what we can do about it. So do you? So I talked a little bit about I thought that stress could affect that as well. But so when you're in a high training load and you're under more stress, then you could get a flare up. Are there any kind of preventative things? The other thing I thought as well was like maybe sports drinks. You know, when you're out on the bike consuming a lot of sugary sports drinks, gels, that kind of thing, does that mess with your gut microbiome, which then, or is it probably more to do with the,
I would say, I mean, you're
mm,
completely right that stress and malnutrition are going to increase your risk of infection and mean that your system is less able to fight infection if you do get an infection. So it's going to take you longer to get over it. It's going to take you longer
mm,
to recover. Um, I mean, having loads of sugary drinks
mm,
is not going to be great for your microbiome. But at the
mm.
same time, occasional, if you are exercising,
You kind of need it
you
when you're
need it.
out?
You also,
Yeah.
that's it. So I think it's that balance. I think, it's okay to have boosts of sort of sugar energy on a ride
Mm,
because you also need that to sustain you. And if you don't, you're going to be
Yeah.
really fatigued and really depleted, and that's going to put you in a cycle where you're going to be more prone to infection. So, I think I would say, you've got to, on those types of rides,
Gotta
or
do
run
what you've
or
got to
whatever,
do.
you've got to do what you've got to do. You've got to have that boost. But, overall, you want to have sort of sensible nutrition just to
Mm.
give you a good baseline, I would have thought.
That's kind of what I would say to people if they were asking. It's like your normal diet, like outside of training, should be introducing those prebiotics and probiotics that you talked about earlier. But then when you're on those long bike rides, you need the sugar. And a lot of people, they don't want, they're trying to find alternatives. And there are some ways around it, but there's not, yeah, you kind of have to just go, okay, this is exceptional circumstances and it's not like my normal diet. And yeah, then so like in your normal life, you wouldn't want to be consuming a load of sugary drinks. You would not have that
Yeah.
in, not be drinking cans of Coke with your lunch or whatever. You'd be
But I think
just,
you need that on a ride. Otherwise, you're just going to be
yeah,
the calorie deficit will be huge and you'll just be destroyed. So no, I
yeah,
think your
definitely.
advice is completely right.
Yeah, yeah, it's just I think sometimes it's hard for people to get because they're like, "This is unhealthy," to having this, and it's like everything, isn't it? It's it can be unhealthy if it's taken to an extreme, and sometimes it will be like when you're training for an endurance event, it can put you into that unhealthy zone for a short amount of time, and then you can come back out of it and kind of build yourself up again because you're kind of pushing your body to its limit.
Yeah.
So it's got to like it's it then adapts. You've got to go there, and so sometimes you have to do things that you think are not very healthy,
Yeah.
which is difficult when you want to train. You're used to exercising for health, and that's sort of what you've got in your mind. It's like
If
a different
you're
way
churning
of
through
doing.
thousands of calories, you've got to
Mm,
put that back into your system somehow. And that's what you've got to do. You've got to match that because otherwise,
yeah.
well, you're not going to train successfully and
No, and then I guess
be
you
far more stressed.
you will be more susceptible to those things as well if you're coming back and you're not refueling or you're not fueling on the ride. You're getting exhausted and other stuff as well. People get, upper respiratory tract infections and, that kind of thing as well when they're under that amount of stress.
Yeah.
Cool. So yeah, saddle sores. We've sort of talked about pubic hair. Is there anything else you want
Oh,
to?
so I suppose, yeah. Why is it happening? Why are we so at risk? Well, you've got your saddle on that area. You're going to be squashing the blood supply to that area. So you potentially are going to restrict the blood supply to that area if you're on a saddle for a long time.
Mm,
You have like this lymph system. It basically sort of drains lymph which out of that area. And so if you're compressing that sort of drainage, that can lead to swelling. And you're also sat on the nerves. So you've got the pudendal nerve that comes in and you're sat on it. So this area is really at risk of damage through pressure, prolonged episodes of pressure, and it can lead to numbness, tingling, pain with sex, pain when you urinate,
mm,
um, and you can also damage the skin. So it can ulcer, it can fissure. So I was thinking about this, like what do I say to people who have got those problems? Like you'll know more than me, like getting a proper bike fit,
yeah.
really important, like getting those handlebars up just a fraction so that it's trying to transfer a bit of your weight back onto the sit bones rather than
Mm,
directly onto the vulva and the perineum is really important. Having a slightly wider saddle, which I know goes against all the nice sort of sleek, snazzy, thin sort of saddles, but having a little bit of a wider saddle just to transfer that weight over a wider area. Um, and then there's the whole thing about vulval skincare, which I
mm.
narrowly
Yeah,
preach
I
about.
was recommended pseudocrine by the time trial ladies, but I don't know if that's great.
What do I
Like,
recommend? So I I normally have to. I really go into like unpicking what is it that you wash the area with? Um,
Mm,
and so it's like, don't just use water, avoid
okay.
soaps, bubble baths, perfume products. Some people use those feminine wipes. I'm like, I think my
Oh,
eyes then widen as a bit of a like, don't do that. This is really delicate skin. So really
yeah.
look after it. So I advise people get an emollient, so like a sort of medical moisturizer, and they use that as a
Okay.
soap substitute. And there are loads of different varieties. Some are prescribed, some you can buy from the pharmacist. It's about finding one that works for you, but they have different water content or oil content in them. And you can get creams, you can get ointments. And essentially, I advise using one as a soap substitute and then getting
Mm,
one that is a little bit more oily, like an ointment, as a moisturizer afterwards. And that can
okay.
be really protective, really moisturizing, nourishing, just to sort of make the skin a bit more robust so that it can
Right.
stand up to this. And it can also be really soothing on the skin. Um, and the other thing that I really would recommend to people is estrogen cream. So it's
Okay.
trial cream and it's on prescription in this country. You can get it over the counter in other countries. And I think that just
Mm,
represents how safe it is. And I think
mm.
people are worried about it because they think, oh my God, it's estrogen in a
Like a
cream.
woman.
It's
Ah,
a
yeah.
hormone, it's hormone replacement therapy, but this is locally acting hormone. You
Okay.
barely absorb it. Like you basically don't. It is so
Okay.
safe, super safe. And you can put it on the skin. And if you've got fissures or an ulcer from cycling, you can rub it on and it will speed up healing. It's
Okay.
really effective. And also, if you are at that stage of life where you're getting a bit older and maybe you're
Mm,
perimenopausal or postmenopausal, then actually the lack of estrogen in that tissue can make those tissues more fragile, more friable,
mm.
more prone to trauma. It can bleed, it can be dry, it can be sore. So actually it's really treatable with some
Yeah,
mild
just a
estrogen and
bit of
estrogen
estrogen
cream.
cream.
Yeah.
Nice.
So I'd really
Okay.
recommend that stuff.
Yeah, no, that's really helpful. So that's kind of led me on to my next question of how things change as we get older, as we age and we're starting to cycle. We're carrying on cycling. We're wanting to carry on doing the same as we did, even though we probably should be thinking about changing things at that point in time. What issues could we face as female cyclists as we age in the sport or triathletes?
I think it's fascinating that there are over 30 symptoms of the menopause. Everyone thinks about hot flushes and maybe poor sleep, but there's actually the range of symptoms that can happen are vast. And so, if we just go a bit deeper into some that I think might be problematic for some people. So one would be vulval or vaginal dryness. And with that comes skin that is more fragile. It can be more uncomfortable. So, more uncomfortable with your saddle. So, doing all those things that we've been sort of talking about are really important. Thinking about some topical estrogen. Also, having a lack of estrogen in that area can affect your bladder. So, it can
Okay.
lead to sort of urgency, getting up in the middle of the night to go, bit of leakage from urgency. Again, all of this is really treatable with some topical estrogen. So either that can be a pessary that
Okay.
you put inside the vagina or estrogen cream. So that's something that I see a lot. And yeah, something can be done about it. So that might be something
Okay.
that does become an issue. Um, the other thing that I thought about was joint aching. So
Yeah.
that's something that I hear a lot from people, just all over body aching and with that fatigue.
Mm.
So it's important to, stretching. I'm not going to tell you about that, but I mean, it's having, good mobility within your workouts, and
Right.
stretching is really important. And it's not for everyone, but I see a lot of people and talk to a lot of people about HRT and systemic HRT, so hormone replacement therapy.
Mm.
I think there's a lot of fear out there about
Yeah.
HRT, but actually there are safe combinations now.
Mm.
many different combinations that can be explored. So, if someone's thinking about it, I'd be like, don't be scared of it.
Mm.
Explore it, go and see your GP about it, get a bit more information. And you could just trial
Mm.
it. It doesn't need to be, I'm going to start it, I'm going to start it for life. You
And
could
have it for
just give
yeah.
it a go and just see if it makes a difference. Um, and then also, like sleep. A lot of people like
Mm.
fatigue and sleep. Um, I mean, you could put anxiety. I see a lot of people who come to me and they're really, really anxious. All of these things are going to impact.
Yeah, and
Maybe
that affects your cycling with fear of descending and,
I hadn't
the
even thought
cars on the
of
road and
that.
all that sort of stuff. Yeah.
Yeah. So some people, again, for some people, HRT will really help that. There's also really strong evidence for CBT. So
Okay.
that can be really helpful for people. And then the other bit is your metabolism changes as as your
Mm.
hormones change. So your weight distribution changes. You get a bit more in the middle. So making sure you've got a lot of protein in your diet.
Yeah.
Doing the strength training, so having a really balanced training schedule that can be helpful. And I suppose with this, I would say to people if they're not sure of where to go, seek some help. Either it will be seeing your GP or maybe it's seeing a physio if it's more of a joint related thing, or a nutritionist, um, or some sort of therapist if you're looking to deal with anxiety from a more sort of holistic aspect. Don't suffer
Mm.
in silence with this. And actually, the other thing, sorry, I will stop talking. I talk too much.
No, no, go ahead.
Like there are some really good apps that can help you track some of this. So there's
Right.
like the Balance app. That's the one I normally recommend to people.
Okay.
See, it's free and you can just
Mm.
track your symptoms. So that can help you sort of work out what's going on. But it can also be quite good evidence to then, if you're going to your GP, it might be a short consultation and you're trying to really transmit that problem. And you could bring up that app and be like, look, I've been tracking it and this is the problem that I'm having. And that can help
Mm.
them see what you're going through so that they can help you help you both address it well. Yeah.
Yeah. Yeah, definitely. I've because I'm 48 now, so I'm kind of like,
You
I'm
don't look it, Celia.
going, thank you. But I am. um, so I've like a few years ago, I had sort of weird palpitations and stuff, and I was getting really emotional, and I just went through this really weird blip, and it happened to me like about the same time every year. And I was like, "Is this something going on?" And I went to see my GP, and she said, "Well, we could." I think it was she suggested maybe antidepressants, and I was like, "No, I don't." I don't know why I even went to the GP because I kind of didn't really want any treatment, but I think I maybe just wanted to talk to someone about it and go, "Is this? Could it be perimenopause or that I'm starting to go through?" And yeah, I came away not have. They did my bloods, I think, and actually I had really low iron. I was anemic.
God.
Um, so I ended up taking like high dose iron tablets, and that's something that happened again like later on with the high training load.
Yeah.
um and I think that might have been causing the palpitations. I'm not sure. It was just would go like weak and not be able to train. So yeah, but I think there was also symptoms of, I do some, I notice my cycle has changed now. It's like I used to get um, be fine. As soon as my period started, I'd be like, yeah, I feel great. I'm much more positive. But I feel like that. And then I get a bout of anxiety. And then I sort of go back into I'm okay again. I have this kind of like weird glitch in the middle of it of being like, I'm a bit anxious now. And I'm like, no, it's because you're feeling like, your hormones are doing weird stuff.
Yeah.
Um,
They are like
yeah.
in perimenopausal phase that can last, for 10 years. Your
Mm.
hormones are just it's just chaos with your
Yeah, I
hormones.
don't know what's going on.
And
I know.
it and I think that's but also you sort of hit the nail on the head with the fact that it's sometimes really difficult to it's very muddy because there's so
Mm.
many different symptoms of it. People are like, is it that? Or is it that
Yeah.
I had a really big glass, or maybe I had one too many glasses of
Yeah.
wine last night, and I didn't sleep particularly well. And I had an argument with somebody, and then I
Yeah.
lost something, or whatever it is. What life factors are also
Yeah.
playing into this? And that's why it's really helpful to track some of it, because then you're
Mm.
like, no, this I'm not going crazy here. This
Yeah,
is
it's like a regular occurrence and it's
thing.
happening at
Thing.
this point
Actually,
in
this
time.
is something I want to address, or at least get some reassurance. You know, you did the right thing by
Mm.
going to see someone, being like, actually, do I need to do anything else about this?
Mm.
Is this normal? Should
Yeah.
I, you know, is this okay? Can I keep managing it as I'm managing because I'm sort of doing okay, or do I need to do something different, or have I missed something?
Mm.
Yeah, you did the right thing by
Yeah. No, I don't, well, the iron definitely improves things.
good.
But also I think it wasn't just that, there was other stuff going on as well. And, like you say, it is very difficult because there's so much going on. Like in my life at the moment, my mum was in hospital for like 3 weeks not that long ago. My son's leaving for university soon. My my father-in-law died like this year. I had a friend, there's all this other
Oh,
stuff that goes on in your life, isn't there? When you're that age, I think you've got like quite a bit, or some, not everybody, but I feel like I've got lots of other stress areas in my life that would
that's good.
impact that anyway. So it's like, okay, it could be that, but it's also to do with this. And I wouldn't ever rule anything out, but I try and manage everything with my exercise habits and my nutrition and my sleep. And I always thought I slept really well. But I wore one of the tracking watches one night and I was like, God, I'm hardly sleeping at all.
God.
I was sleeping, but it's like I wake up quite early in the morning and then
Yeah.
I'm obviously not quite sleeping, but sort of am and sort of aren't. And I think that's quite common for women of my age, is they wake up super early and then mine starts.
Disruption sleep is a really common thing in this
Mm,
phase. But it sounds like you're doing a lot of the right things, like the
mm,
exercise, the nutrition, sleep, thinking about sleep hygiene. They're all really
yeah.
important things that,
Yeah,
yeah.
I like wind down for ages before I go to bed. It takes me, I've never been like up all night anyway. I'm kind of an early bird, but and for people that aren't, I think they find that really hard to implement that then, because they've been used to, I don't know, burning the candle at both ends, and suddenly it's like I can't do this anymore. How do I cope? And you're used to doing a volume of training, and then suddenly you're tired because you didn't get enough sleep, or your joints are aching and you're stiff and you're sore, and you've got to just change things up quite a lot, and it can be very hard for people to let go of that
What they were
part
doing
of
before.
themselves,
Yeah.
because it is like a part of yourself. You're kind of like, well, I'm not gonna be that, I'm changing, everything's changing, your body's changing. It's quite a major thing, and maybe we don't think about it enough or sort of give it as much, I don't know. I feel like I try and minimize it anyway, and probably a lot of people do because they don't want to admit that they're getting older, and it's okay to do that, to get older. It's
I think it's,
gonna happen to everyone.
well, that's it. So I suppose, there is the potential for grief in that, like,
Mm,
oh, that's what I was, that's what I was doing, that's what I was achieving at that point. But actually, that it needs to just stay as a celebration of check out all this incredible
yeah,
stuff that I did. And yes,
yeah.
I am changing, but I can still do all this incredible stuff. I'm going to do it in a different way.
Yeah, and also I find like it's that wisdom as well that comes with it. It's like, well, I did this and I've learned that, and I can implement it this way now, rather than, I've got a 14-year-old son and he's like, "Ah," kind of just full of china shop, kind of like throwing himself around and doing this and the other, which is great. It's so cool to see like so much energy and things. But the experience that I have, I can kind of like go, okay, well, why didn't we think about it, you know? And so we have to celebrate that we have that experience in our lives and that kind of sort of groundedness, I suppose, and that's a good thing to be able to bring to anyone, really. So yeah, it should we celebrate that and celebrate being older and having the. We have to get back to the wise woman, don't we?
Exactly.
The
Yeah,
wise elders.
yeah, wisdom, lived experience. Yeah.
Yeah, no, it's good. It's cool to to acknowledge it and appreciate it rather than fearing I'm going to get older and everything's going to be gone. I won't be who I was. No, you're going to be a better version of yourself.
Exactly. A better version. That's what you should
Yeah,
focus on. Exactly.
definitely. Yeah, because I think people think it's all downhill, don't they? And it's not at all. It's it's a
It's
lot of good
definitely not.
things. No,
I'm not accepting that because, yeah, I don't want that in my
no
future.
well, it
Not
isn't.
having a downhill in my
It's
future, so that's fine.
no, it won't be. It won't be. It definitely won't be. Not if you've got. I think it's a mindset. You know, I'm always talking about mindset and mental attitude, but it's so important. And I think with aging, especially because we've all got fixed ideas of what it's going to look like, and it doesn't have to be how you have been told it's going to be or what you imagine. Anyway, I'm
Agree.
rambling now.
I agree.
So yeah, I've written that balance app down. I'm gonna find that and put it in the show notes. But yes, that's a really good tip for tracking stuff. Is there anything else that you want to add or that you'd like
Oh,
people to know about? I'm sure there is stuff. But
oh, I suppose my biggest message would be just that I want people to talk about it more, like, and not
mm,
be fearful of it. I don't want, if you're thinking, oh my God, I'm really not very comfortable, I'm not feeling confident about cycling or about any issues gynecological related,
mm.
don't sit in silence. Don't fear going to see a gynecologist. Yeah, I'm not
Well,
very,
if everyone's gynecologist was like you, I'm sure they'd be
I'm not a very
very
scary
pleased.
person. I'm maybe a bit too open. Oh well, never mind.
No,
Uh,
it's nice to
but also,
have
I think
a
like other
female as well and someone that understands your sport. You know, that's a big thing for a lot of people. I was just talking to a client the other day, and she said, "This person didn't ask me anything about my lifestyle, and they said I'm going to have this operation. It's, uh, you know, and it will stop me running." And so, yeah, it was kind of like,
if I mean, I'm not even a, I don't do any substantial running, or I'm not a remotely, I'm not a professional athlete. And if somebody told me that I was going to have an operation that was going to stop all the activity that I do, I'd be
mm,
absolutely like devastated. I struggled
mm,
breaking a finger, and they told me I couldn't cycle for 6 weeks. I mean,
yeah,
yeah, it's massive.
yeah, I know. I think sometimes the messages can be delivered like a little bit more like considering you know people's circumstances and their lifestyle and yeah I mean
And
it's
actually, the other thing I suppose that I want to add is that if people do develop issues in that area, maybe they've got a lump. So, one, I'd really recommend that people take a look at their vulval area. People might not
mm.
want to, but get a mirror, look at it, familiarize yourself with what normal is for you. Because if it is, if you notice skin changes, an ulcer, a lump, you're having bleeding, lots of itching, you know, don't just assume it's because you got on your bike and spent too much time on
Mm.
your bike. Because some of those symptoms can be a sign. I don't want to scare people, but sometimes
Mm.
those symptoms can be a sign of something else.
Yeah,
And so, if that's the case and you're not sure, it's much better to just get it looked at and checked out and reassured, because you wouldn't want to miss anything. So that
yeah.
other sort of thing to people is that it's far better, have a look, note it down. If you want to take a photo,
Mm.
like, and just, yeah, don't be afraid to just go and ask someone about it, because it's really important and you wouldn't want to miss anything.
Yeah, definitely. I think I've quite often I've been to a GP or someone and gone in with something just to get it checked out and then come away not doing anything about it necessarily, but just for that reassurance. And I think sometimes that's all you need is some reassurance that everything's okay. And sometimes it might not be, but you
That's
know,
it. And
most of the time you go and it's like, yeah, it's fine.
good,
So,
and that's great. And if it's fine, then fabulous. But also at the same
but
time, if
it's my, yeah,
any
you need the
tests
peace
or
of
need to look
mind,
at
don't you?
biopsy or whatever, then at least that can be done and done in
Mm,
a timely fashion rather than someone sort of ignoring it for ages. That wouldn't be wise. So,
yeah. Okay.
there you go.
Awesome. That's great
Yeah,
advice.
I'm confident in the area. It can be comfortable. Yeah.
Yeah,
Don't be
and
afraid
then
to talk about it. There's lots that you can do to make it more comfortable. Take a
yeah,
moment. Yeah.
yeah. Okay, brilliant. Well, thank you very much for your time. It's been amazing chatting with you. Thank you so much. And yeah, if I had any issues, I'd definitely come to see you.
Oh, and you're welcome to ask me. That'd be absolutely fine. Just reach out if you've got any questions
Oh, thank
about
you.
any of it. And yeah, and thank you for this opportunity. It's been,
No
yeah,
worries.
chatting about it.
And if people want to follow you, you're on X, aren't you? And
I
are you
am
anywhere
that
else that you want
Instagram. Not
to?
yeah,
Okay.
I'm not very good at posting stuff. I probably should post more educational things, but
Oh no,
yeah, I think people can do.
you
But
can only do so much, can't you? That's the thing.
that's it.
So I'll post links to those
Yeah,
to X and your Instagram
thank you.
below, and people can kind of connect with you there. And thank you so much for your time. It's been
All
amazing.
right, my pleasure.
Thanks for listening today. Have a great day. Take care. Bye for now.